So we're talking about the most requested nose for most of my female patients, which is, I call it the 4Ds. And those 4Ds are going to be D-projection. Projection is how far your nose sticks out. So to D-projection a nose means to move it closer to your face. Decreasing the length, that's the second D. And the length of your nose is for where it starts all the way down to your tip. So if your nose is longer, it can be closer to the bottom of your face. So decreasing the length means to actually shorten your nose. In some cases, that means actually lifting your nose up in the air. The third D is to decrease the bump on the nose. And for many patients, they may have a small bump, they may have a larger bump. This doesn't necessarily mean patients want a nose with a scoop, but most patients want their bridge of the nose to kind of correspond to the rest of their nose. Most patients want the tip to be the leading point of the nose rather than the bridge be the first thing you look at. And then how much the tip leads, or how much scoop you want, can be very subtle. It can be straight, it can be zero scoop, or it can be a little bit more dramatic depending on what your aesthetic is. And then the final D in my most requested female nose is going to be decreasing the size of the tip. The nasal tip is what you see when you're looking at the nose front on and when the nose is lifted and with the head down. That's the actual width of the distance between your cartilage. And it's just changing the shape of the tip. Imagine the tip being almost like like the end of a microphone. And a lot of my female patients want that microphone tip to be smaller and more delicate. The benefit of decreasing all four of these Ds is you're going to have less attention on the nose. A smaller tip, smaller bridge, a bridge that's brought down, less projected nose. All of that attention is going to be recaptured in your eyes, your cheekbones, and your lips, which is the ideal of an ideal rhinoplasty.